Hello everyone. In this session, we speak about health implications of climate-induced disasters. So let's start our session about introduction to climate-induced disasters. Climate climate change is increasing the frequency and intensity of extreme weather events, floods, heat waves, storms, droughts, and wildfires. These disasters have profound and multi-phased impact on human health globally. Understanding these implications is crucial for public health preparedness and response. Direct health impact, injuries and fatalities, direct physical harm from extreme weather events, drawing trauma from collapsing structures, heat-related illness, heat stroke, exhaustion, and cardiovascular conditions during heat waves. Infectious diseases increase risk of waterborne disease, cholera, typhoid, and vector-borne disease, malaria, due to altered environmental conditions, respiratory issues, smoke inhalation from wildfires, and increased air pollution from dust debris. Disruption of healthcare service, damage to hospitals, clinics, and supply chains, limiting access to essential medical care, food and water insecurity, destruction of crops, contamination of water sources leading to malnutrition and dehydration, displacement and migration, mass displacement of population leading to overcrowding, poor sanitation, and increased disease transmission in temporary shelters, economic loss and poverty, long-term financial strain impacting access to healthcare, nutrition, food, and safe housing. Vulnerable population, child and the elderly, more susceptible to illness, injury, and psychological trauma. Low-income communities often reside in areas more prone to disasters and have fewer resources for recovery. Individuals with pre-existing health conditions, disasters disrupt medication access, ongoing treatment. Indigenous populations and marginalized groups often disproportionately affected due to unique social, economic, and geographic factors. So let's start a case study. Hurricane Katrina. Um, yeah, causing massive floods and infrastructure collapse, immediate health crisis, burning injuries, and delays in emergency medical care, long-term impact, widespread mental health issues, depression, anxiety, and chronic diseases to lack of medication care and resist healthcare access challenges for years. Public health challenges, management of contaminated water, mold exposure, and reestablishment of public health service. Typhoon Haiyan, one of the strongest typhoons to make landfall, devastating the Philippines. Immediate health crisis, tens of thousands of injuries and facilities, massive destruction of health facilities, long-term impact, outbreaks of waterborne disease, cholera due to contaminated water, food shortage, and ongoing mental health challenges for survivors. Reconstruction challenges, difficulty in rebuilding health infrastructure and restoring essential public health service in affected areas. Post-traumatic stress disorder, common among survivors. particularly those who experience severe loss or trauma, depression, and anxiety, chronic stress, grave and displacement, contribution to long-lasting mental health burdens. Impact on children: increased rate of behavioral problem, anxiety, and learning difficulties. Post-disaster: importance of psychosocial support critical for healing and community resilience, often overlooked in initial disaster response. Strengthening health infrastructure, building climate resilience, hospitals and clinics. Rewarning system, implementing robust system for extreme weather events to allow for timely evacuation and preparation. So public health preparedness, developing comprehensive plans for disease surveillance, emergency medical response, and mental health support. International cooperation, global efforts to reduce greenhouse gas emission and support vulnerable nations in adaptation. Community engagement, empowering local communities in disaster preparedness and response of efforts. Thank you so much.